Hey everybody, welcome to Eyecare today. We are here and very excited in the Hazleton Eye Specialist office at the Big Eyeball on Airport Road. So if you're taking down a drive down Airport Road in Hazleton, look for the Big Eyeball. That's where we're located. Just in case you wanted to know, the address is 281 Airport Road, again at the Big Eyeball. And we're also in Tannersville at Stroudsburg Eye Specialists, and that is behind Friendly's on Route 611. And the telephone number there is 570-421-3342. So today we're going to be talking about diabetes, one of the biggest public health concerns that we face on a daily basis. It's an extremely important part of what it is that we do as eye doctors, and we wanted to just overview the condition, why it's important, some of the integral roles that we play as eye care providers in diagnosing diabetes, and then ultimately what we do from an eye care perspective, both from a technology standpoint and also from an evaluation standpoint, to help people reduce the risk of vision loss from diabetes. I am joined today by Dr. Belanger. We are very, very happy at Hazleton Eye Specialists and Stroudsburg Eye Specialists to have Dr. Belanger be part of our team. She's been with us for how long now?
2.5 years.
2.5 years, and she is making some regular appearances at our Hazleton office. How's that been going?
It's good.
Wonderful.
We're busy and lots of kids, and it's great.
What do you think about diabetes?
What do I think about diabetes? I think it's the one thing that we all could do better at preventing.
Absolutely.
As professional eye care specialists or any type of healthcare profession, as well as you yourself can do things to help prevent it. However, it is one of the most common types of chronic conditions in the United States. So it's very important to be talked about.
Just a quick little commercial for Dr. Belanger. She's accepting new patients in both our Hazleton office and our Stroudsburg office, and somebody who's definitely adept in all levels of care, but in particular diabetes management and management of eye care related conditions to do with diabetes. So in that vein, let's talk a little bit about diabetes, because that's what this is all about. Let's get the education to our patients about diabetes and why we care so much about it. So diabetes, on any given day, how many people do you think you see who have diabetes, that know that they have diabetes? So maybe you see 20 patients a day. How many of those have diabetes?
Probably between 25 and 35% of them.
So a quarter to
about a quarter
more.
of them, yeah.
Now, what percentage of the patients that you see on a daily basis do you think have diabetes but don't know they have diabetes?
I think that I think there's probably quite a bit, because diabetes is something that is pretty common to be noticed in the eye. So we are one of the first lines for seeing diabetes or picking up on diabetes. However, I think we've done a better job as of recently as healthcare providers in screening people, and starting treating people even earlier than normal, or people that are at higher risk.
And the statistics are pretty impressive. I think people should know the number of people with diabetes right now that are diagnosed. How many millions of people do you know?
There's about 30 million people in the United States
and that's with diagnosed diabetes. 30 million people in the United States, which is around a quarter of our population. So that's number one. Number two, how many people have pre-diabetes? Are you familiar with that?
I'm not familiar with the pre-diabetics, but that's something that they're trying to screen more of.
Sure.
I know.
I think it's around 90 million or 60 million, and it's a significantly larger number. And the big thing with that is a lot of those people don't know they have it.
Right.
they don't know they have prediabetes. And so that's one of the things we're trying to do a better job at with the help of your primary care doctor, is determine what the risk factors are that we can help identify you as a diabetic. And it's important because if we can get ahead of it, then maybe we never get to the point where there are eye conditions. So let's talk a little bit about some of the risk factors and what diabetes is. So what are some of the risk factors that you look for in someone who's coming to your office today to see you for an eye exam, and you're thinking, well, gee, maybe a diabetes workup is something that we should do for you? What are some risk factors?
We look for, it's very, it gets much more common as you get older. So people above, people above 45, that's a big number. People that are overweight.
Okay, obesity.
Obesity is a big thing, and that's becoming more of an issue in our country, and they're kind of tied side by side. We look for, I think it's a little bit more common in the Hispanic, African American communities.
Absolutely. So race and ethnicity.
Race and ethnicity play a role in it, and family history. That's something we pay a
So
lot
if
of attention.
grandma or grandpa or uncles or cousins had it, that's something we actually care about. And I think sometimes people say, oh yeah, well, grandma, uncles, Bob had diabetes and didn't really think too much of it. Maybe they didn't live a healthy lifestyle. But now we're understanding more that diabetes is not only just about lifestyle, it's also about genetics.
Right.
So that's important. What else?
There's certain things or complaints that we have patients say that make us kind of think on that train of thought. A lot of fluctuating vision. Glasses sometimes work, sometimes they don't. Sure. Blurred vision. There's lots of things. Dry eye can be associated or be tied in with diabetes. So there's lots of things we think of when we initially do the history of a patient. And that's why the history is so important, and that's why we always spend a lot of time going over family history and current history and medications and things like that.
Yeah, and diabetes is one of those things that has effects to all parts of the body, definitely the eye. And we think we need to do a better job. It's part of the reason why we're having this conversation here today. So if you're someone who is having maybe we put on a few pounds, maybe we have a family history, maybe you have high blood pressure, maybe you are thirsty a lot and urinating frequently. Those are some of the symptoms that we find associated with diabetes. If you're over the age of 45 and you've not had your blood sugar checked, or you have any of those other symptoms that I just mentioned, you should have your blood sugar checked. And I will send patients to get their blood sugar checked often. Two things that we look for is a fasting blood sugar and also something called an A1C measurement, which is a more global measurement of your blood sugar over the last 3 months, where a blood sugar measurement is going to be right there at that time, and it's going to have effects on what you were eating and just what was going on in your life at that time. Stress could cause that to go up. So that's the introduction to diabetes and what we should be looking for in patients that are presenting to our office or even a primary care office to diagnose them with diabetes and determine whether or not they're at risk for diabetes. When we come back from this break, we're going to talk a little bit more about what diabetes is and exactly what is going on in the body that ultimately causes some of the things that we see inside the eye. Thanks for joining us on Eyecare today. We'll be right back. Welcome back to Eyecare today. I'm here with Dr. Belanger. We are so excited to be talking to you about diabetes. And just in case you didn't know, we are located here at Hazleton Eye Specialists on Airport Beltway by the Big Eyeball. Drive by, check it out. It's a great new landmark in Hazleton. 281 Airport Road, Hazel Township, PA. Telephone number is 570-453-2020, and our brand new beautiful office in Tannersville on Route 611, right behind the Friendlies in 611. That's 2943 Route 611, Suite 5. Telephone number there is 570-421-3342. And check us out on the website. We have a wonderful website at www.drkislin.com. So we just got done talking about diabetes, particularly what kind of risk factors we should be looking for, and some of the risk factors you and I are looking for. So I think a lot of people think, well, I'm going to the eye doctor, I'm just getting my glasses and my contacts. We do way more than that. And one of the things we do is we screen for risk factors. We measure blood pressure. We talk to patients about their weight. We sometimes measure their weight and look at, some risk factors in determining whether or not that person should be having a blood sugar measurement. And so we will often recommend that they go get primary care visits as a result of that. So what is diabetes? So I always tell patients diabetes is too much sugar in the blood. Do you have any way that you distill diabetes down to somebody and just say, hey, this is kind of what you could think of it as?
Yes, very similar. It's too much sugar in the blood, and it's like traveling through a tube, or where our blood system and our blood vessels are a continuous motion, and we have a liquid traveling through that. And I always think of it almost as if the buildup of sugar in our bloodstream is the cause of the damage to the blood vessels.
It absolutely is.
Whether it's too big, or whether the molecules are too big trying to travel through the blood vessels.
Tiny little blood vessels,
exactly.
Right? And I remember hearing that in school and thinking to myself, wow, I never really thought of it that way, that the sugar in the blood is toxic to the blood vessel walls. It is actually what is causing the problem. And it causes all sorts of other problems in other end organs, like our eyes and our kidneys and our liver and our toes and our nerves in our body. So really what's happening is, again, too much sugar in the blood. There may be an issue with the pancreas, the organ in our body that secretes something called insulin. Insulin is partially responsible for our utilization of blood sugar, glucose, as we eat foods and break it down into different little tiny things that our body can use for energy. And then insulin coming from our pancreas helps us utilize that. And so there may be some insulin resistance, and our body is not using insulin the right way, and the pancreas ends up getting damaged, or we are just intolerant to it. And so this ends up with too much sugar in the blood. And I often will say it's kind of like having molasses or syrup going down a blood vessel. It's, I think, what you were describing exactly. And it's just not getting where it needs to go. Or just the fact that that blood sugar is there can damage some of the walls in the blood vessels. So that's what's going on in your body. And we can see signs of that, of course, in the eye. What's one of the most common things you see in the eye that you can relate to what I just described about diabetes?
Yeah, so one of the first things we see is little specks of blood in the back of the eye, and they are little hemorrhages that pool in the back of the eye or the retina where the blood vessel was damaged. So the blood vessel...
Too much sugar in the blood.
Too much sugar in the blood, damage the wall of the blood vessel, and the blood kind of just pools out. And we can see little specks initially in the very early beginnings of it.
A question about that. Does that hurt?
No. So that's a big thing with any eye problem in the back of the eye of the retina. There is absolutely no pain. No pain receptors in our retina. So you will never feel this. You will never know what's happening unless it's diagnosed and we see it on imaging, or we see it during a dilated eye exam.
And our eye exams really, I think, go the extra mile to look for that. And so if you see somebody, again, that has those risk factors that we discussed, you're going the extra mile to find that, correct? Because are they easy to see? Is that something that's, you just look back there, you could see it, or is it something you have to kind of work for?
The mild forms of what we call diabetic retinopathy, sometimes you have to look for it, and sometimes you have to really scan the retina and be able to see the retina as close as possible and as wide as possible to find the early signs of it, which is usually when the patient doesn't know they have it.
Right.
So those are the important people for us to really see, or and really look at the very microscopic forms of it.
So let's say we have a patient come in. They came in because they can't read. A very common reason why patients come in, let's say they're 45 and they're going through a very common thing called presbyopia. It means you can't see up close anymore. And so we do a very thorough eye exam, and you find some retinal hemorrhages. And you take a look at the patient, you say, well, we're probably a little overweight, and have a candid conversation with them about that in their best interest, and say, do you have a primary care doctor? No. What do you do? Do you set them up with somebody? You recommend somebody? What's the process look like?
I think that's usually the biggest thing for me is to get someone a foundation of a primary care doctor, because that's going to be someone that they're going to have to go to very frequently, and or when things are stable, something that's going to follow and manage their health overall. So that's really important. So I usually try to find a primary care doctor for them, or we will run blood work in the office or send for images or scans. Sometimes we have to scan the carotids with an ultrasound if we see hemorrhages in the back of the eye. So there's usually a process we go through, but I think it's very important that people get established with a primary care doctor.
Sure. And that's a big thing that we try to do, and like you said, we try to sometimes expedite the process and get some blood information on our own. So I think the next step is really important too, in understanding that there's things that can be done. And the earlier we check up on those things, the earlier we get somebody established, the better and more likely it is that we don't end up with vision loss, because ultimately that's what we're going to talk about after the next break, is vision loss from diabetes. And so the big thing that people can do to get diabetes taken care of, number one, is diet and exercise, right? Diet and exercise. Nobody wants to talk about diet and exercise. Nobody wants to do it. Believe me, I don't, but I love food, and so I need to watch what I eat. I guess I'm getting older. My bald spot's getting bigger, so I need to think about what I'm eating a little bit more. And this is a conversation I'm having more with patients, is saying, hey, eat this, not that. Go for a walk instead of, sitting and playing on your phone for 10 minutes in the morning or in the evening. And so that's going to be something a lot of primary care doctors are going to be talking about. They're busy. And so maybe, we can do a little bit better there too. Is that something that you do in your exam ever, is talk about diet and exercise?
Absolutely. That's, I don't think, sometimes we have to realize that primary care doctors can be so busy that they, we neglect to explain the things going on. And exercise is a big thing. It's a great way to burn that extra sugar in the bloodstream.
Right.
So if we have a buildup of blood sugar in the bloodstream, the best thing to do is to manage what we eat and burn it off. And those are very important conversations. And unfortunately, there's been a lack of education throughout all of our lives. It's not something that was ever necessarily discussed in school or in the community in general. So I think it's a great conversation to have with patients, just on the importance of it.
And a 50,000 foot view, I think we'd like to make sure people get out, walk 20, 30 minutes a day, maybe 4 or 5 days a week, get cardiovascular exercise going, number one. Number two, stay away from the whites, stay away from sugar. Try and eat more whole grains, veggies, 3 square meals. Those are some of the recommendations if you look at the American Diabetic Association. Certainly I'm not a dietitian or a registered dietitian, but we'd be happy to hook you up with one if given the opportunity to give you a great eye exam. So that is the conversation about diabetes so far. I'm here with Dr. Belanger, our newest addition at Hazleton and Stroudsburg Eye Specialist, and we're here talking about diabetes, the importance of diabetic management, and its relationship to your eyeballs and, of course, your vision. On the next part of our talk, we're going to be talking about vision loss associated with diabetes and what we can do to avoid it. Hello everybody, we're back for our final segment of diabetes here with Eyecare today. We are here at Hazleton Eye Specialists at the Big Eyeball on Airport Beltway. Our address here, of course, is 281 Airport Road, Hazel Township, PA 18201. That's by the Big Eyeball on Airport Road. So check us out. Telephone number is 570-453-2020. And we have our beautiful new office, a wonderful facility in Tannersville on Route 611, right behind the Friendlies on Route 611. That's 2943 Route 611, Suite 5. Telephone number there is 570-421-3342. And I'm joined by my wonderful co-host and colleague, Dr. Corinne Belanger, a native of Tannersville, right? You grew up in Tannersville.
Absolutely.
Tell
Yes,
me, where'd you go to school?
I went to Pocono Mountain.
Pocono Mountain. What's the mascot there?
Pocono Mountain. We are a cardinal.
A cardinal.
We're so fierce.
That is
so
really
fierce.
not that fierce. Well, I was a Viking, a Bishop
Okay.
Hayfie Viking, and they were pretty, pretty tough.
It's pretty tough. Yeah, definitely can
But that's
outdo
great.
the cardinal.
Did you play any sports?
I did.
What
so
did you do?
I was field hockey,
Okay, cool.
soccer, and basketball. I was a three-sport athlete at Pocono Mountain.
That is fantastic. So health and fitness and well-being and all this sort of plays into everything you are and who you are. And
Absolutely.
it's something you really do care about. So we were just talking about, some of the things that we can do to talk to our patients about diabetes and how to avoid it and how we could be doing a better job and how we do a very good job in telling patients not only, yes, you may be at risk for diabetes, but also let's find out. Let's not just leave it to chance. Let's get you a doctor or send you for blood work. It's something we do all the time. And then lastly, let's help you on that journey. Let's talk to you about diet. Let's talk to you about exercise. And then the other thing that a lot of patients are going to have to deal with is medicine. And so the most popular medicine that patients get put on for diabetes is metformin, a medicine that has been around for as long as diabetes has been in existence. It's been around a long, long time, decades, and it is very effective. But of course, there are some side effects, most notably stomach discomfort. So there are many different blood sugar controlling medicines on the market, and certainly something that I think is very important for patients to adhere to, if their doctor is recommending that for them. So let's talk about diabetes now in the eyes. So people have been with us here the last 25 minutes, and they're wondering, when are you going to talk about the eyes? So now we're going to finally talk about the eyes and how we really start to play an integral role in the delivery of health care for a patient with diabetes. So can you tell us a little bit about some of the things that you see early on with diabetes in patients?
Yeah. So one of something that's very, very common is the fluctuation in the actual glasses prescription or the vision. And oftentimes that's with diabetics, usually newly diagnosed and unstable. So we talk about blood sugars that go from very, very low to very, very high. And the instability or the inconsistency in the actual blood sugar is what can cause the lens that sits inside of our eye to swell, which would then change the prescription. Mm-hmm. And as the swelling comes down on the lens inside the eye, then it changes the prescription back to normal. So you have this fluctuation in vision, and that can be very common.
So what do you do? Do you have to make them diabetes glasses that change somehow every time their blood sugar changes?
That wouldn't be a bad idea.
It's a pretty good idea. They want to patent it.
The idea behind that is to get their sugar stable. So that's a call to the primary care doctor and a nice talk to whoever's treating the diabetes that the sugars are just not stable enough. And that's apparent in the fluctuations we see in the actual eyeglasses prescription, that the patient is kind of all over the place. And, that's a conversation with the patient as well, to educate them on why it's happening, what is happening, and what they can do to make it better for themselves. So that's a very common thing we notice. Diabetics are also at a risk of earlier cataract development. So there are certain cataracts that are more common in diabetics. One of the big one known is called a posterior subcapsular cataract, and for short we call them PSCs, and they develop pretty quickly, pretty rapidly, and can really, really, really fog your vision compared to the other types of cataracts. So those two things are things that we can see early on before any permanent vision loss, because these things are we can treat and help before anything becomes permanently damaging.
So what would a patient look for with that very unique type of cataract that you mentioned? Is there something they should see?
Something that becomes much more difficult is reading. Your up-close vision becomes much more difficult, and some people describe a film over their eye. It basically what it is growing in the back of the lens is a film, and like I said, it usually progresses pretty quickly. So you might have good vision 1 month, and 2 months later you are really, really blurry.
Does that hurt?
It doesn't hurt.
It doesn't hurt. Oh my
does
goodness.
not
Okay.
hurt. No,
But it fogs up their vision.
it fogs up their vision.
Okay, got it. And how would you correct that? Would you be able to give somebody an eye drop for that, or a pair of glasses, or?
If a cataract was to develop and it's significant enough that it is fogging the vision, then we would have to do cataract surgery.
Okay.
We'd send you to a cataract surgeon and cataract specialist. We work with Dr. Bucci, and we get that taken care of, and that's another process that we go through.
And that doesn't hurt either.
That doesn't hurt either.
Perfect.
No.
This is an easy one. There's two other quick things that I'd like patients to know about, some technology that we have here in the office to evaluate diabetic changes in the back of the eye, which is ultimately what causes vision loss. One of the biggest reasons for vision loss among working age people is diabetic retinopathy, the bleeding in the back of the eye. When that's getting out of control, that can get to a point where the only thing that's going to fix it is injections into the eye or laser into the eye, which honestly that doesn't hurt that much either, but I'd rather not have to do it if I didn't have to. And certainly we're gonna experience some vision loss at that time. People even go blind, and we see that all the time. So two other technologies that we have here, and we're going to show a picture of it right now, is a scan of the vasculature in the back of the eye. And so this is one of the earliest indications that there might be changes to the blood vessel in the back of the eye. So if you have diabetes, this is a new technology that's only available at Hazleton Eye Specialists and Stroudsburg Eye Specialists, and you should really come and get this scan to see if there are any early changes to the back of the eye. It could help your doctor determine whether or not you need better, sharper, stronger blood sugar control. And then the other test is an electrodiagnostic test, which actually measures the strength of the eye. A very unique test, again, something only Hazleton Eye Specialists and Stroudsburg Eye Specialists have. So we are very, very excited to be your premier eye care provider in northeastern Pennsylvania, located in Hazleton and in Stroudsburg, specifically at Tannersville. We're very excited to have Dr. Corinne Belanger, someone who's very passionate about diabetic eye care and care of patients of all ages and backgrounds. But having this technology is something that really allows us to go the extra mile and being able to determine what we need to do to help reduce the risk of vision loss for you and your loved ones. Thanks for listening to us today on Eye Care Today, and we'll talk to you soon.